Fourth, take a cue from elective services and modernize your ability to predict costs. There's a billboard in Nashville. It used to be up, and it was a plastic surgery practice that had, I think their special was like, the $4,000 breast augmentation or something.
Oh, yeah.
It was right there on the billboard, 4K breast augmentation, right? I don't remember if it was 4K or what it was. Point is, for elective services are really good at communicating what things are going to cost.
Right.
And it's obvious why, because those elective services, people are paying out of pocket for those. But people still have questions, even if they have insurance and insurance is paying for it. Maybe, Michael, they are coming to the end of the year and they're trying to decide, maybe they have a yearly maximum out of pocket, maybe they're getting close to it, maybe they're deciding what to do to push it this year, next year, and the cost that is billed to insurance actually matters. Figure out how to tell people how much stuff costs. And now here's the thing. People just want an answer, right?
Yeah.
They're not going to get mad. Like, I know it. You can't predict it because there's different insurance, depends on what they have. I get it. Give them a range. Give them a range.
Yeah,
and
that's
it doesn't
a great
matter
idea.
if it's
just like a range. That's super helpful.
$5,000 to $12,000 is fine.
Yeah.
I used to work in my company used to do video, and a common thing was how much it's going to cost. And of course, you got to scope it out. How long is the video? How many on-screen actors? Blah blah blah. But I learned pretty early on that people just want an answer. They're not going to get mad if you tell them 7,000 and it happens to be 8,500.
Yeah.
Or 10,000. But if you tell them, oh, this is around 7,500 to 12,000, depending on the scope, let's talk a little more. That's all they want to hear. So figure out how to tell people how much your services cost. The plumber does it. Their accountant does it. The grocery store does it. Every other place that they go to does this.
Yeah.
Figure it out.
And more people are paying self-pay. So in my family, we do self-pay. We're part of a healthcare co-op. And it's not that we don't have the money. It's that we find it to be a better experience in doing healthcare coverage.
Yeah.
And it's a lot more affordable. We're a family of 6. It's a lot more affordable.
Yeah. And I can't, and I'm going to say it again because I can't stress it enough. People aren't looking for an exact number that they're going to hold you to and pin you to the ground for. They just want to know a range, and they have the right to know that before they engage in services, just like any other service that they partake in.
Yeah.
This is no different. So figure out how to tell them how much it's going to cost, even if it's a big range.
Yeah.
That you owe it to them as your patients and as your customers.
Yep. Awesome.